So in this video, we're going to talk about ways to describe skin lesions. Let's begin with a macule. A macule is described as a flat, circumscribed alteration in skin color. An example of a macule is a freckle. A papule is a circumscribed, palpable elevation, less than 5 millimeters in diameter. An example of this is a mole. The one up from a papule is known as a nodule. A nodule is a circumscribed, palpable elevation greater than 5 millimeters in diameter. An example of a nodule is a wart. If the lesion contains fluid, this can be referred to as a vesicle, as long as it is a small collection of fluid below the dermis, and it's less than 5 millimeters in diameter. An example of this is a blister caused by the human simplex virus. If the fluid is greater, if the blister, you can say, is greater than 5 millimeters, it can be referred to as a bulla. A bulla is a large collection of fluid below the epidermis, greater than 5 millimeters. An example of this is a burn blister. Remember that a vesicle and a bulla are a collection of fluid below the epidermis. A pustule is pus. Pustule is a visible collection of pus. And a pustule can be an acne, for example. A lesion can also contain fluid within the dermis layer, not the epidermis, but the dermis. And this is known as a wheal. So a wheal is an area of dermal edema. An example of this, a wheal condition, is known as hives, which is an allergic reaction. A plaque is a palpable raised flat disc-shaped lesion, and it's often solid. An example of a plaque lesion can be seen in psoriasis. If the skin lesion looks crusty, we can use the term crust. A crust is defined as dried serum and exudate. An example of crust lesion is we can see in impetigo residues. Scales can also be used. Scales is defined as an accumulation of excess keratin. This can be seen in dandruff. Dandruff is an example of scales. Finally, a term that we should be all familiar with is ulcer. And ulcers can be found in the skin, in the gut, because these ulcers occur on epithelial cells. An ulcer is described as a circumscribed loss of tissue. An example is a pressure ulcer. So those were some terminologies or terms used to describe lesions. Again, macule, papule, nodule, pustule, wheal, plaque, crust, scale, and ulcer. So that was it for this video, terms used to describe skin lesions. Next, we will look at some common skin disorders and hopefully incorporate some of these terms to describe the common skin disorders. Thanks for watching.